report of WHO. Last week, the West Pacific area, including China, there are reported 37 new coronavirus cases. The fifth branch of the COVID-19 has spread to most part of the region, increasing the number of affected and severe cases and pose severe challenges to China's medical system. Now, there has been sporadic cases in China, in a couple of regions in China, and the spread link has not been fully cut across China. So we must stick to our general principle of cutting the spread of the virus and roll out specific measures for precise treatment of the cases to cut the further spread of the COVID-19 cases. For the import ports, we will take serious measures and to put in place the closed-loop management to cut the spread of the cases to other parts of China. And we will implement an emergency response system and to run it in an efficient way. We will roll out the vaccination across China. So today we will publish a new guideline on the safety and efficiency of the vaccination in China. We're glad to have with us the experts from the vaccination management team, the academician of the Chinese Academy of Sciences, Mr. Zeng Yixing, and the expert vice director of the vaccination development team, Mr. Wang Junzhi, and from the PLA hospital, the infection department, also the academician of the CAS, Mr. Wang Fusheng, and from the National Health Commission, the R&D department and the vaccination team, Mr. Feng, and also Mr. Feng Zijian, the Vice Secretary General of China's Prevention Disease. And also, the floor is open to questions. Please identify yourself first. Now, the first question. Thank you. I'm from Xinhua News Agency. According to previous reports, that the infection rate among the Chinese elderly is the vaccination among the Chinese elderly is quite low. Could you give us further information? Well, thank you for your interesting question and also your concern about the vaccination among the elderly in China. Now, I'd like to give you some information. Recently, under the concerted efforts of the governments at all levels and the general vaccination, the vaccination in general in China has reaped a lot of progress. As of 18th of July, in 3.4 billion doses have been applied among the Chinese people, benefiting 1.298 billion Chinese people. The full range vaccination has benefited 1.2490 billion people, covering 86.7%. For the strengthened dose, for the boosted dose, there has been 71.7% of Chinese people that have received a booster. For the elderly that aged over 60 in China, the coverage rate amounted to 86 89.6%. For the booster coverage rate, 67.63%. So given these numbers, you can see that the elderly in China have received the vaccination, and the vaccination has covered a wider range of elderly people compared with the past. But there are still some problems, especially for those aged over 80s. And the vaccination still needs to be improved among these people. And also they need to further improve, receive the booster. For those who age over 60 to 69, the coverage rate is 91.8%. For the basic immunity dose, 89.1%. For those aged over 70 to 79, 92.1% received once-for-all vaccination. For those who age over 89, the coverage rate is over 70%. So these are the numbers about the one dose and full dose. For the booster, the coverage rate is 76.8% and 69.9% for 80 to 89, and 38.4% for those who age over 90. From the start of last year, China rolled out a full-scale campaign across China for its people. As the elderly has a lower rate to get infected, so our vaccination policy is to give priority to those who are more prone to be infected, especially those who work in a inbound and outbound entrance and exit areas. But for the current stage, the elderly has become our priority for the vaccination. Compared with the foreign data, the elderly has a higher rate to be affected based on the underlying diseases, and they reported a higher death rate. And the elderly is different from the young people because they are less immune. They need a booster more than the younger people to get protected. So I'd like to call on everyone to aid our elderly people, to provide convenience to them as to the vaccination. And let's work together to improve the vaccination rate of our elderly people. The second question. Hi, I'm from a CCTV channel. Well, 3.4 billion doses of vaccines have been provided and have been injected in China. So how can we ensure the quality and the safety of the vaccination in China? Well, Mr. Wang Junzhi will take your question. Thank you for your question. In China, when the Chinese vaccination went to the market, we need to make some policies to ensure they are secure. Before they reach the public, the enterprises have a set of standards to check the quality and the safety of the vaccination, including the chemical indicators, physical indicators, and other indicators to ensure the safety of the vaccination. Another one important step is to go through the quarantine of a quality check of the Quality Check Bureau. And we need to follow the international standard to apply a examination. So the Chinese legal quality check institutions will go through the quality check and approval according to the national standards. After they are approved, we will provide a quality check report. So before the vaccination reaches the public, they need to go through the approval of the enterprise and also the quality check authorities. Apart from that, as the number of doses has increased remarkably, we have to follow up with the production scale. So the national government at all levels have introduced policies to ensure the capacity of increasing the supply of the vaccination. We have dispatched special personnel to the enterprises to follow up with the quality of the vaccination to ensure that the vaccination complies with the national standards. When the vaccination is ready for public use, we increased the production lines. And we also made specific production guidelines and also a monitoring system to ensure that each and every dose of the COVID-19 vaccination can be traced. So these measures are put in place to ensure that each dose is safe and secure. Thank you. I'm from People's Daily. It has been over 1 year for China to introduce the vaccination across the country. So what role and what are the effects of the vaccination in terms of preventing infection and deaths? Mr. Wang Fusheng will take your question. Thank you for your question. You can rest assured that according to the clinical studies, the vaccination has played a significant role in avoiding the severe cases and the deaths from the COVID-19 infections. I can give you some numbers. Recently, Hong Kong and Shanghai, the epidemic in these two areas has been very severe. For those aged between 18 and 59, for those who have been vaccinated, their infection rate and the death rate is 60% and 65% lower than those who have not been injected. And the rate of severe cases is 91% lower than those who are not vaccinated. For those who age over 65, the number is 73% and 82% lower respectively than those who are not vaccinated. And the number can be 89% and 95% respectively for those who age over 90. So China's vaccination standards are in line with that of WHO. That is to prevent infections from COVID-19 and to prevent deaths and to prevent severe cases. First, after the human body is vaccinated, we may have different immune symptoms. As the COVID-19 continues to develop, the response from the vaccination and protection from the vaccination is different. Among those who are affected, there has reported some disruptive infections, but we have lowered the risks to a great extent compared with those who are not vaccinated. Still, we need to wear masks. And if we wear masks and we are vaccinated, we are better protected. So we need to give further play to the role of the vaccination in preventing and containing the COVID-19. And we'd like to thank you for your understanding, because that is the only way for us to better contain the COVID-19. From China Media Group, since the epidemic outbreak, the virus continues to develop. Is the vaccination still effective against the COVID-19? And how is the development process of COVID-19 of vaccination? Can we catch up with the spread of the virus? Mr. Feng Zijian will take your question. Thank you for your question. Well, the variant of the COVID-19 virus, it has been more adaptive and more flexible. And it has affected the number of infections. Well, the infections are related to the cells and the immunity of the cells. Yet the vaccination proved effective against the infections and deaths, and also the severe cases. So it is fair to say that the Chinese vaccination is protective. For those vaccination that has been rolled out in Hong Kong and SAR and the mainland of China, they have proved effective in preventing the severe cases and deaths. For those who age over 60 and received the 2 doses, the vaccination has demonstrated a 60% of protection rate in preventing the severe cases and deaths. And for those who age over 70, the protection rate is over 90%. For the Omicron vibrations in certain parts of China, we compared the data on the vaccination. For those who age between 18 and 59, for the asymptomatic cases, and that develops into the severe cases, the rate lowered by 91% and 94% respectively. For those who age over 60 years old and who are vaccinated with 2 doses, so the protection rate is over 85% and 94% respectively than those unvaccinated. According to the reports of WHO, the Omicron variant, after it is listed as a major variant, we have carried out the studies and R&D activities, we have reaped fast progress in a number of vaccinations that are being tested in Zhejiang and Hong Kong. And for another type of vaccination, it has been approved in the UAE. For other types of vaccination, for the reorganized protein type, we have reaped faster progress. And we have submitted the application material for clinical test. For the vaccination types that has reaped faster progress, we have also submitted reports for clinical studies. As long as there is a need from the public, we will launch emergent response for the fast application of the vaccination. As to the time and application of the vaccination, we need further studies, especially to how they will develop. Thank you from coverage front page news. In China, the elderly who age over 80, many of them live alone without a family protection. So, do these people need a vaccination to get protected? Thank you for your question. It is a very good question. The elderly people you referred to just now need the vaccination. It is urgent for them to get vaccinated, and these people take up 40%. Most of them live alone without a family company, and some of them are disabled. And they live in the countryside, in the rural areas, and they live in a very remote part of the country. If they are not to get, it is a very dangerous thinking for them to not get vaccinated. As the number of asymptomatic cases continues to rise, they need to get protected by the vaccination. If one family member is a asymptomatic case, when they return to their family, or when the family members visit the elderly, it is likely they will spread the virus to the elderly. If the elderly are not vaccinated, it is highly likely that they will be dead because of the virus. We need to promote the vaccination among those elderly people, especially the booster. So it is keen for us to improve the vaccination rate among the elderly people to guard them against the severe cases and the deaths. And this will help China have China better fight the COVID-19 epidemic. Thank you from Pengpai News. Lately, there has been reports on the internet that some people got leukemia and diarrhea and other diseases because of the vaccination of COVID-19. So, could you further explain on this phenomenon? Well, Mr. Wang Fusheng will take your question. Thank you for your question. I can assure you that the vaccination from COVID-19 will not lead to leukemia and other diseases, as rumors run on the internet. The COVID-19 vaccination will not arise diabetes or other severe diseases. These rumors are irresponsible, and I can explain from 3 aspects. First, the vaccination is safe. It will not arise the diseases. The antibody is about the microbe antibody. So the ingredient of the vaccination is in line with the national safety standards. They will not arise diseases by themselves. The antigen used for production of the vaccination are also safe. The reagents are also safe. The density of the chemicals in the vaccination is below 2.6 mg. It's very low coverage. The largest, inactivated vaccination are safe in China. For example, the hepatitis A vaccination and the mad dog the rabies vaccination are also safe in China. And across these years, there has been no single report about this vaccination that lead to the leukemia. The vaccination of the COVID-19 has been listed as on the list of the emerging vaccination for international use. So China's vaccination is safe. Thirdly, according to the data from clinical research, after 4 years of COVID-19 outbreak, the hospitalization rate of the affected of the leukemia patients and diabetes patients is not different. And there is no difference in these patients, the number of these patients after they get vaccinated of COVID-19. So the hospitalization rate is 0.15% and 0.14% respectively for the patients of leukemia and diabetes. And for those who got vaccinated, the number is 0.13%. So after the COVID-19 outbreak in 2020 and also from the data in 2021, the percentage of hospitalization of the leukemia patients and diabetes patients reported a 2.1% respectively. So there is no difference for these patients after they got vaccinated. For the young people who age over 12 and 17, the vaccination rate is 75% and 100% respectively. So 250 million young people have been fully vaccinated. Even if even when there are some deaths, and they are not caused by the COVID-19 vaccination. If the COVID-19 vaccination can really arise leukemia and diabetes, there must be a surge in the number of hospitalized patients. Yet the statistics shows no difference. So based on my analysis, I can assure you that the COVID-19 case, vaccination will not lead to leukemia or diabetes. Thank you. I'm from China, the financial sector program of the CMG. So there has been reported some new strains of the COVID-19 virus. For example, the BA.5, BA.6. So how are they different from the previous strains? So will they affect the vaccination and also the testing regions? Thank you for your question. The coronavirus, we have been 2 years. This is the second year into the COVID-19. Especially the Omicron strain. Compared with the Alpha and the Delta viral strains, the Omicron shows more characteristics. The Omicron has challenged our response policies. So we must follow closely how the Omicron will develop and evolve. And we must make pre-response analysis. So since BA.1 appeared last November, there has reported a BA.2, BA.4, BA.5. We follow closely the characteristics of the viral strains. For the most prevalent BA.4 and BA.5, I'd like to give you some information. BA.4 and BA.5 appeared in the early stage of the Omicron based on BA.1 and BA.2. And the major difference between them with the BA.1 lies in the protein, in the S protein. The S agent is the same, but the S protein is different. According to the statistics, BA.4 and BA.5 spread even faster than BA.1. According to our calculation and a prediction, the spread speed is 9.5%. 9.5. BA.4 and BA.5 may lead to as to the severity of the cases, there is no difference between the BA.4, BA.5, and BA.1. As to the elderly infection, BA.4 and BA.5 has a higher risk of arising infections. According to current studies, the viral strains made no difference to our testing reagents, but they have challenged our treatment medicines, especially for the micromolecular medicines. After we look into the serum of the vaccinated groups, BA.4 and BA.5, showed some difference. The cellular immune response, the vaccination proved more effective against BA.4 and BA.5. As to the pneumonia and the severe cases and deaths incurred by BA.4 and BA.5, our vaccination still proved effective. So we should not be that worried about BA.4 and 5, and BA.2 and BA.7.5. And we will take more efforts to guard against the epidemic. Thank you for Hong Kong Business News. The vaccination has been rolled out in China for quite a number of time. So, is there any difference among the vaccinations? Thank you for your question. I believe many are interested in this question. After we have rolled out a national campaign for the full vaccination. And according to our study and according to our follow-up efforts on the developments of the viral strains, the effectiveness of the vaccination has lowered day by day. But for the vaccination that follow the same technical routes, we have intensified the vaccination's effectiveness, and they have proved very effective against the severe cases and the deaths. According to full research and verification, we need booster injection based on 2 doses. So, in response to your question, which type of vaccination is better? If we take the vaccination with under one type, and this is one solution, and there is another solution that is to receive the vaccination of different types, and they proved effective in the same way. There is no much a difference. Thank you from China News Agency. As people have been vaccinated, why are there still cases of infections? Thank you for your question. I think many people are also interested why people are infected again after getting vaccinated. Well, first, since the COVID-19 outbreak, the science and technology progress has contributed to the discovery of the infections. And this is a rare in history. The disruptive infections include a large number of asymptomatic cases who have a risk to infect others. For example, the measles protection, they may report explicit infections, namely the asymptomatic cases that are hard to detect. For the COVID-19 infections, there are also asymptomatic cases. Secondly, the COVID-19 virus may report genetic change. They may report genetic variation, and they may arise the respiratory diseases, and they may affect the effectiveness of the vaccinations. So these may cause the disruptive infections again. And the disruptive infections are also related to the upper respiratory route infections, because this part of the throat will replicate, will be easy for the virus to get replicated. The virus may reach the lymph system of the body. If you get vaccinated, you will get protected because you will acquire the immune cells. Although these cells do not appear in the respiratory system, they can make the virus stay at the surface of the respiratory system, making it difficult for the virus to replicate at a larger scale. That is why we have reported the asymptomatic cases and the mild cases, but very few severe cases. If you are not vaccinated, it will be easy for the virus that enters the blood and the body system to get replicated. For the elderly people who have underlying diseases, if they are not vaccinated, they have a higher risk to get infected. So even if there may be disruptive infections after getting vaccinated, the vaccination still proves strong protection against the severe cases and deaths, because the vaccination is the most effective and the most economical and the most affordable measure to guard against COVID-19. We shall reject the idea to not get vaccinated simply because the infection may happen again. When one gets vaccinated, he or she may get infected again, but we shall not reject the idea of vaccination because of that. For the Southern Metropolitan Daily, for the elderly who have underlying diseases and chronic diseases, how can we communicate to the medical workers to help the elderly to evaluate their health situation and whether it is likely for them to get vaccinated. Thank you for your question. I can assure you that the COVID-19 vaccination in China is fully safe. Even if you have been vaccinated to other diseases, for example, the flu, for other diseases, you can rest assured to get vaccinated on the COVID-19. According to the real situation in China and outside China, the underlying diseases are not the major cause of the death of the COVID-19. But if you have an underlying disease and not vaccinated, you may have a higher risk of death and a severe case once you are infected with COVID-19. So the elderly are more strongly recommended to get a dose of COVID-19 vaccination. As long as the health situation of the elderly is stable and they take the medicine on a regular basis, they are recommended to get vaccinated. But there are a number of cases that you should pay attention to when getting vaccinated. In the past, there are reported severe allergy after getting COVID-19 vaccination. For example, the edema, and if you have a fever, you have a severe fever, you should stop getting vaccinated. And if you have high blood pressure and have some nerve diseases, you should not get vaccinated until you recover. So these are the cases we do not recommend you to take the vaccination immediately. Thank you. I'm from the China Educational Channel. Someone complained that the COVID-19 vaccination is not protective enough. Is that the real case? And how is the protection among the children? Mr. Wang Junzhi will take your question. Thank you for your question. Actually, you have asked two questions. To answer your first question, the dose selection is very important. We will set different dose for the vaccination, and we will collect the data from clinical studies and foreign experiments, and to set the appropriate dosage. So from the animal experiment and also the human body experiment, the inactivated vaccination have shown good indicators and showed nearly 100% protection against positive infections. So the indicators have shown they are in line with the national standards. And the dosage we suggested is appropriate for the Chinese people. We must give priority to the safety of the vaccination. And we have followed up with the protection rate of the dosage compared with MI vaccination produced by other countries. And China's vaccination protection rate reached 97%, almost the same with those from outside China. Second question, the protection rate for the children is the same with the protection of the adults. The children also receive the same dosage with the adults. And this is evidenced by our experimental data from clinical research. Compared with the hepatitis A vaccination and other vaccinations like the rabies, we have compared the children's dosage with the adults' dosage, and there is no much difference between the two. So the dosage is for the adults, the dosage is 31 mg and 100 mg respectively, but for the children, the dosage is one-third lower, one-third of the adults' dosage. Because we use different the regions of the vaccination is different. So we don't have to compare the dosage of the children with that of the adults. I'm from the Economic Observation Daily. We follow up the reports of the COVID-19 vaccination response, and some have reported some negative response. So could you further give us some information? First, I'd like to call on everyone to separate the correlational causes from the truth. China has a sound monitoring system for the vaccination application. For the preventive vaccination, so all those who have reported a negative response after they get vaccinated are called the post-vaccination reaction, including the coupled reaction. If a severe case is in an incubation period, after he or she is vaccinated, the disease appears. But the disease is not caused by the vaccination, and it is not part of the negative reaction from the vaccination. For example, if a hepatitis B patient get vaccinated of COVID-19 and he or she shows hepatitis B, that does not mean the disease is caused by COVID-19 vaccination. So we are keen to screen out these phenomena. But China has a vast population. Every day, 660,000 people are hospitalized because of severe diseases, and including 20,000 deaths from the severe diseases. So the coupled reaction is natural. we must be sober-minded of this phenomenon. This does not mean these severe diseases are caused by the COVID-19 vaccination. It is not. Actually, China has established a sound system for selecting and detecting the coupled reaction. And we asked these cases to be reported. And the experts will intervene and diagnose. And it is for the experts to provide a scientific conclusion. And the experts will give a comprehensive conclusion on the adverse reaction, even if it is truly caused by COVID-19. And the government will provide subsidies for the patients. From 21st century economic news, well, over 300 million doses have been rolled out in China. Has China monitored the adverse reactions among the vaccinated people? Well, Mr. Feng Zijian will take your question. Well, 3 billion doses have been injected in China, and we have the situation is quite safe. And the rate of adverse reaction is even lower than those who are vaccinated with regular vaccinations. China has put in place an internet-based reporting system of adverse reactions of vaccination in 2008. The authorities and departments in this area work together to monitor the data for a comprehensive analysis. In 2011 and 2014, China passed 2 rounds of evaluation from WHO on the adverse reactions of vaccination. So, the national evaluation and monitoring system of the adverse reactions proved effective. And China is conducting a 3rd round of review from the WHO. We have involved the medical institutions and the authorities in terms of the adverse reactions. We have set expert teams to analyze the reports and data and to conduct professional analysis and to conduct the analysis of the cause and effect. Well, China has reported 3.38 billion doses of vaccination. 238,000 people have reported adverse reactions. This is a very low rate. So over 57% of the people have reported the adverse effects. Among those who have reported adverse effects, only a low amount of people reported the reactions from COVID-19. So it is a rate of only 6.9 against 1 million. and the figure is 1.7 per 1 million for the dosage. And because 2 doses were against the vaccination rules, and 1 case reported a wrong vaccination because the person got vaccinated twice between the interval time is over. So the major adverse affections is fever, allergy. The top 5 adverse reactions are allergies, taking up over 50%. So a shock for the allergic shock, and the cases took up 2%. And we reported 290 Guillain-Barré syndrome, taking up a low rate. So the figure is lower than the vaccination of regular doses of regular diseases. As another expert has mentioned previously, the adverse effects from the vaccination of measles and hepatitis B has nothing to do with the COVID-19 vaccination. And this means that the Chinese COVID-19 vaccination is fully safe. Thank you from China Network. Some say that after they get vaccinated, they cannot find the antibody. They question the effectiveness of the vaccination. So what will you do to help us monitor the antibody? Well, thank you for your question. We have noticed these reports. In this room, I have answered similar questions, and I'd like to answer your question again. You have raised a question about the antibody test for everyone. Well, my answer is I don't think this is necessary, and this is possible. Because the animal experiment and the human body experiment has shown that the vaccination is fully protective. For a positive case, the protection rate against the positive case is 100%. And we have been rest assured by the data from the vaccination. If you have not observed an antibody, that does not mean the vaccination is not effective. The antibody level may decrease after it occurs shortly after the vaccination, but that does not mean the antibody does not exist. So the level of antibody does not represent the protection rate of the vaccination. Currently, the Chinese vaccination can arise the antibody and also the immune protection. You may recall when you were small, you are vaccinated on the measles. And the antibody is not tested and cannot be observed either. Yet the vaccination is still effective. Well, the testing of the antibody should take place in P3 level laboratory, and that incurs very high costs. The comprehensive antibody or the protective antibody, as you refer to, is the antibody that inactivates the virus. You must take this antibody this vaccination to the P3 level laboratory for the detection of the antibody. Yet, the regular reagent toolkits cannot help detect the antibody. Another point is that the foreign countries do not test the antibody either. This has been shown in history. There has not been such a full-scale antibody test in China or outside China. Well, the point on whether if vaccination is still safe and protective, we should refer to the comprehensive data for a science-based theory. The China's vaccination has been listed in the WHO's emergent use list. So we have no need to question the safety of the vaccination. So it is not possible and it is not necessary to test the antibody of the vaccination. Thank you. I'm from Phoenix TV. There has been reports that question whether the Chinese leaders have been vaccinated. Can you answer this question? Mr. Zeng Yixing will answer your question. Thank you for your question. I can give you a responsible answer that the Chinese leaders, top leaders, have been vaccinated and they have been injected the Chinese vaccination. This shows the great attention placed by the Chinese top leaders on the COVID-19 situation. And China has produced 3 types of vaccinations that have been listed by the WHO emergent use list. And the Chinese vaccination has been listed as the only one vaccination that applies to children. Turkey, Cambodia, Philippines, UAE, Indonesia, Peru, Chile have all vaccinated. Their top leaders have all vaccinated to Chinese vaccination. This means the Chinese vaccination is very popular among the foreign countries. Thank you from Hongxin News. We learned that in normal cases, a certain group of people may report severe allergy after they get vaccinated. So, is their life under threat? Can you answer this question? Thank you for your question. Similar with other vaccinations, after one gets injected of the COVID-19 vaccination, they may report acute allergy like shock. Though these symptoms are rare, they may threaten the people's life. Normally, within half an hour of vaccination. So they need to take pills to appease the situation. Well, we have take into consideration this phenomenon. So we have emergent response actions against these acute allergies, like preparing the pills and the medicines. And we strengthen the trainings. And we have trained professionals to intervene once the acute allergy appears. And we have asked the people to get vaccinated, who got vaccinated, to stay on site for half an hour, so that the medical staff can observe their symptoms and intervene. If the allergy occurs, no matter it is acute allergy or is it incurred by the COVID-19, we will give priority to the treatment of the patients. Last but not least, the full vaccination of COVID-19 has shown through data that the adverse reaction treatment is timely, scientific, and effective among our people. Thank you. I have noticed that the floor has many questions, and this floor allows for the last 3 questions. Thank you for the daily economic news. Through the spread of COVID-19, there has been some crowd infections. So how is the situation among the elderly? How is the effect of the vaccination among the elderly? The Omicron spread has affected Hong Kong on a larger scale, also in Shanghai. And in Hong Kong, reported the 5th wave of COVID-19 infections, with 60% for the elderly people who age over 60, taking up over 95% of the total infections. For Shanghai, reported 627,000 infections. The elderly who aged over 80 take up 67%. So there is a higher risk among the elderly over the young people. The Omicron variant has lower toxicity, but a faster spreading speed. So we have a number of data to show you. According to the study in Hong Kong, for those who are not vaccinated, the death rate compared with is 3-folds and 18-folds and 19-folds compared with those who got 1 dose, 2 dose, and 3 dose. For Shanghai, the figure is 6-folds, 17-folds, and 57-folds. Although the figures are different, but the trends are the same. This fully says that the vaccination is highly protective for the elderly. So it is highly necessary for the elderly to get vaccinated. There are 35 million elderly people in China who have been vaccinated, but there are still more people who have not been vaccinated and who have not got a booster. Once the elderly are infected, and there is a higher risk for death and a severe case. So we must respect the precious outcome from the dynamic zero policy and call on the elderly to get vaccinated. From the health news, China has developed several types of COVID-19 vaccinations. How can we evaluate the safety and effectiveness of the vaccinations in a scientific and effective way? Thank you for your question. Up till now, China has approved 64 types of vaccinations for going to the public, including 5 for clinical studies. China has put in place a sound legal system and technical route guiding system. Generally speaking, the development of vaccinations must pass the clinical study and clinical research and clinical experiments, including the medical research. We must ensure a steady flow of production tools. We must ensure quality check and to make sure the animal test and repetitive toxicity tests and also the animal protective experiment are rolled out. Only after we go through these steps, we can allow the vaccination to go to the public. And China's vaccination experiment has 3 stages. One is to ensure its safety. The volunteers receive the doses to ensure the safety. We need over 10 people to receive the test. And stage 2 clinical study is expands the number of testing people and the doses. And this is for the purpose of collecting the safety data. And this may involve more than 100 people. And then we enter the 3rd phase based on the 2nd phase. And this may involve over 10,000 people to get tested. The 3rd phase requires the tests in the prevalent regions. We need a double-blind group comparison, and the infection rate, and we will compare this data to see the protection rate of the vaccination. And China has done a good job in containing COVID-19 across the past years. So China has a low number of patients. So the phase 3 experiment is mostly rolled out outside China. And this is the first time for China to conduct large-scale phase 3 experiment in another country. So after the vaccination reaches certain standard, we approve it for going to the market. The evaluation process of the vaccination has allowed us to ensure the safety of the vaccination, and we cannot accomplish this far without a sound system, without the effective measures, without the speeding up of the R&D process, without lowering and because we have followed closely the requirements of the nation. One last question from CGTN. The Chinese vaccination, the inactivated vaccination, and the reorganized protein vaccination, compared with mRNA vaccination outside China, and some question that the foreign countries may have a better vaccination, and we question why the foreign countries do not produce the inactivated vaccination. Thank you for your question. I think this is a question that interests many. We must be clear that inactivated vaccination is not a bad technology. It is a mature technology. The regular vaccinations, including the hepatitis B vaccination, the rabies vaccination, are all inactivated vaccination. And in the development of the COVID-19 vaccination, we have developed new technologies. For the mRNA vaccination, it is targeted at treating tumor. So the mRNA vaccination application in human body is the first time in history. That's why we call mRNA a new technology. But it is just different the mRNA and the inactivated vaccination are just different. You questioned why China does not develop mRNA vaccination and foreign countries do not produce inactivated vaccination. Because to develop and produce the COVID-19 vaccination at a larger scale, it may involve high costs and a long production period. At the early stage of the virus, it is difficult to calculate and predict whether our input will yield high results. So we are honest in our action. The governments at all levels worked in concert to roll out the production guidelines of the inactivated vaccination and put in place the construction of the production workshops of the inactivated vaccination. And that ensured the success of production in China. Actually, the foreign countries are also following up with the production of inactivated vaccination, but their progress is quite slow. For example, India is pressing ahead with this research. France is also developing the inactivated vaccination, and they have rolled out the application in UK, in Australia. the Turkey also has developed such an inactivated vaccination that has been applied in some certain countries. So it is fair to say that inactivated vaccination is a mature technology that is embraced by quite a large number of countries. Well, thank you all the speakers, and thank you the members from the press. Well, they have bring us the latest information on the vaccination application in China. And we have answered 19 questions on the floor. And we will continue with our presser. Thank you for your continuous attention. That is the end of today's presser. Thank you.